think they focus on the death panels, which will be coming. Call them what you will. Rationing is part of it. And
I agree. Huge. It's going to be a huge issue, and that's something else about which the president was not fully forthcoming and straightforward.
Right, so you believe that there will be rationing, aka death panels?
It's built into the plan. It's not like a guess or like a judgment. That's going to be part of how costs are controlled.
What? That was Mark Halperin, senior political analyst for Time magazine, in an interview yesterday that is still echoing across the country. Halperin's one of the most respected journalists in this country. Like him or not, he is. So his claim that Obamacare rations health care is getting a lot of attention. Today, he has tried to walk back those remarks in a tweet in which he said, in Monday interview, I did not say death panels, nor do I believe ACA, meaning Obamacare, contains them. Was speaking of political policy challenge of independent advisory board cuts. My bad. Joining me now, Michael Cannon. He's written about this for Forbes.com. He's also the director of health policy studies at the Cato Institute. Michael, good to see you.
How are you, Megan?
I'm going to get to Halperin's walk back in a moment because I want to play the viewers again what he specifically said and what his denial is, because it seems very suspicious that now he's claiming he did not say X when the tape simply is pretty clear he said X. But this issue about death panels and this board has been a real point of contention when it comes to Obamacare from the beginning. Is it true what he said initially on that tape, that the death panels, so-called death panels, and rationing are built into this law?
Well, the whole purpose of the Independent Payment Advisory Board is to reduce Medicare spending by lowering the prices that Medicare pays to doctors and hospitals and so forth, and changing the way it pays these doctors and hospitals. And supporters of the law acknowledge this, that it's supposed to set prices. Well, the power to set prices is the power to ration. If the government sets the prices so low that no doctors will provide a certain service, then you are rationing care. But the IPAB, as we call it, can even go beyond that. It can, despite a prohibition on rationing that's in the statute, it can even tell seniors you're not going to get specific treatments. And the reason is that prohibition on rationing is absolutely unenforceable. It is toothless. The IPAB can do whatever it wants, and it's going to take 60 votes in the Senate to override and block what the IPAB did.
Is there some political check on the IPAB? In other words, they start denying seniors a bunch of end-of-life care, and the American people are going to rise up.
Well, first, I want to clarify something. The whole idea of death panels is a very inflammatory term. If what IPAB is doing, or what the National Institutes for Clinical Excellence in Britain are doing, is trying to find cost-effective ways of spending taxpayer dollars on health care, what that means is that it's not a death panel, it's a life panel, because it's trying to purchase the most life, the most health per dollar spent. Now, if you have a problem with that, then you have a problem with the government buying health care, or you like high taxes. I have a problem with government buying health care, so I don't want the government in the business of doing this. But this is baked into the cake, as Halperin said. This is part of Obama's plan, and he has not been honest with the American people about this aspect of it.
Now, you have been talking about this for some time as somebody who studies the health care law, and I thought it was interesting that, Mark came out and said what we heard him say on the Steve Malzberg show, and then he sends out yet another tweet. We showed you the one tweet he tried to walk it back in. The second one reads as follows: Howard Dean, the IPAB is essentially a healthcare rationing body. Again, not endorsing that. Halperin says, again, I am not endorsing that view, but shows coming political challenge. I am not endorsing the that view, that this is a healthcare rationing body. You go back to what he said on the show, and let's hear it again.
All right, so you believe that there will be rationing, aka death panels?
It's built into the plan. It's not like a guess or like a judgment. That's going to be part of how costs are controlled.
I mean, he's explicit that he believes this is coming. So my question, because then he goes on and he challenges the media for its coverage of the law, and says that the media needs to be much more explicit in covering this particular aspect of it, the IPAB, and what it's going to mean for people in their care. Now, I ask you, when you have tried to speak out about this issue before, what kind of feedback have you gotten? And have you had a lot of people interested in having a full, free, and fair discussion with you about your predictions about this board?
Well, look, Halperin wants to sell books to Democrats and he wants to sell books to Republicans, and so he doesn't want to alienate either side, and I understand that.
With the truth?
But he had it. But he had it right the first time. And this gets to your question, which is, when you try to have a rational discussion about this, when you try to walk through the provisions of Obamacare that establish the Independent Payment Advisory Board, the powers that it gives to that board, the restrictions it places on Congress's ability to knock down the laws that that board is writing, there are even provisions in Obamacare that say that if Congress doesn't repeal IPAB through a very narrow 7-month window in 2017, or 8-month window, which is, according to the statute, the only time Congress can repeal it. If Congress fails to do that, then it loses the ability to ever change or block any law that the IPAB writes in perpetuity. You try to have a reasoned discussion about this, and what happens? You have the folks on the left jumping down your throat saying, no, there aren't death panels here. Groups like PolitiFact have called that the lie of the year. PolitiFact didn't know what they were talking about. PolitiFact got that completely wrong. Fact checkers get things wrong all the time. But what they've been able to do is they've been able to shame people like Halperin out of having a rational discussion about these issues, and And so the public is worse for it, because we don't know how this board is going to operate and how it's going to affect our lives.
And we need to know. Thank you very much for coming on. We'll have you join us again. Thank you so much, sir.
Anytime.
All the best. Taking your thoughts on that. Follow me on Twitter @Megyn Kelly. Let me know what you think.